Okay, so we've been talking about South Korea and their birth rate woes. So the fact that they tried to implement this policy is quite silly and head scratching. This happened back in June, and they were basically trying to take away epidurals, pain meds during childbirth. Why would any normal thinking woman want to get pregnant knowing that they can't dull the pain of labor? I don't know if they actually implemented this or whatnot because there was a lot of public outcry. This is literally the latest article that I could find. I didn't see if they actually changed the policy. Anyways, let's talk about this. Like I said, this happened back in June. It says anxiety rises over ban on combined use of anesthetic drugs during childbirth. Soon to be mothers are expressing confusion and fear over the health ministry's delayed review of a ban on the simultaneous use of epidurals and continuous infusion of local anesthetic, widely referred to as pain busters, during childbirth through C section. Their anxiety is intensifying as the ban is about to take effect next week, unless the ministry announces a decision to amend it. Earlier this month, the ministry said it would reconsider the ban, announced last month after facing a huge backlash from pregnant women who criticized the government for restricting women's right to choose. Online communities have already been filled with inquiries posted by pregnant women whose due dates are approaching. My due date is July 11th, and my C section date is set for July 4th. My doctor told me to choose either epidural or anesthesia or pain buster, citing there are no new guidelines from the ministry yet. A woman wrote on Naver Cafe with over 3 million members. I am very afraid when thinking that I will lose one option for pain control. An epidural is a numbing medicine given by inserting a needle and a catheter into the lower part of a woman's back. A pain buster is a continuous infusion of a local anesthetic into tissue surrounding the surgical incision via a catheter placed during surgery prior to wound closure. These two methods have been widely used together for pain relief during C sections. In this case, the National Health Insurance covers 70% of the epidural and 20% of the pain buster. Controversy began after the Ministry of Health and Welfare said last month that it would impose the ban on the simultaneous use of the two, except in cases when a patient cannot have an epidural. If a pain buster is used alone, the national health insurance coverage would be reduced from the current 20% to 10%, which means the patient should bear the remaining 90%, the ministry said at the time. It said that the decision had been made based on a report by the National Evidence-Based Healthcare Collaborating Agency, which stated that there is no significant difference in terms of pain relief when an epidural is used alone and when it is used together with a pain buster. The report also said a pain buster is not recommended as it contains much more anesthesia than the epidural. The decision, however, provoked immediate criticism from women for limiting mothers' choices for anesthetic procedures. In particular, critics questioned the appropriateness of this policy at a time when the country is fighting low birth rate challenges. They said women's hesitation to give birth will only worsen if such a policy is implemented. Effectiveness of medications differs between people, and women need all possible options when giving birth because of the unimaginable pain, said a 35-year-old Jungnang district resident who has a 2-year-old son. It seems very irrational that the government limits pain control options, considering that it is women, not policymakers, who give birth. Politicians join the criticism. Jeon Yoon-soo, a Supreme Council member of the main opposition Democratic Party of Korea, said on June 12th, these days, 1 in 2 pregnant women opt for giving birth via C-section. The government's abrupt policy change is raising fears and anxiety of these women who have made a difficult decision to give birth in this low birth era. Growing criticism has led the ministry to move to reassess the policy. On June 11th, it said, we will listen to more opinions of pregnant women, doctors, and experts before finalizing the scheme. But with less than a week left until the ban is to begin, the ministry has yet to announce the finalized version. Some local media reported that the ministry may allow simultaneous use of epidurals and pain busters, but completely remove the national health insurance coverage for the latter. Amid mounting speculation and confusion, a ministry official said the issue is still under review. How many women, how many women do you believe? Let's just throw a number out there. How many women do you believe were in the room as they made this decision for pregnant women? The birth rate for South Korea is in hell right now. And this is really going to make women who are not yet pregnant be even more trepidatious. Because why? I don't even know I've never heard of a pain buster up until this situation. But why would women do this and their government is perfectly fine with just snatching away their options? Absolutely let this birth rate continue to plummet to hell. Join the conversation. Let me know what you think about this. Let me know, have you heard of a pain buster before? Don't forget to like, comment, and share. The next country up to talk about as far as birth rate declines is Greece. So this article is from the Greek Reporter. Demographic crisis in Greece, dramatic decline in births in 2023. I am so thankful that so many people send me these articles knowing that this is so interesting. So, this article says a recent Elstat report shows the extent of the demographic crisis Greece is experiencing with significant decreases in births and increases in divorces in 2023. Specifically, according to the data, births fell short of deaths by over 56,000 people. So there were over 56,000 more people who passed away than were born, a figure that demonstrates the country's growing problem. Birth rate declines. In 2023, births in Greece recorded a 6.1% drop compared to previous year, amounting to over 71,000. In contrast, the number of deaths was over 128,000, a 9% decrease compared to 2022. However, deaths still far exceed births, which deepens the demographic gap. Infant mortality also increased, with 248 deaths for infants under 1 year old, raising that rate from 3.1 in 2022 to 3.5 in 2023. How family trends have changed. There have been a noticeably marked change in family dynamics. Total marriages in 2023 fell by 6.9% to 40,351, with a balance between religious and civil marriages, though there are still more church weddings than there are civil ones. At the same time, cohabitation agreements increased by 17.4%, indicating a shift towards alternative forms of partnership. Of these, 262 involved male couples and 121 female couples. Divorces increased. The 4.4% increase in divorces in 2023, with a total of over 15,000 cases, suggests a dynamic change in social structures. Of these, over 12,000 of the divorces were consensual, 80.8%, with the majority being marriages lasting more than 10 years. The age groups most affected are men aged 45 to 49 and women aged 40 to 44. The ratio of divorces per 100, the ratio of divorces per 100 marriage increased to 37.5 in 2023 from 33.4 in 2022, indicating a growing trend in marital dissolution and a change in personal relationships. So, marriage is on the rise, and it looks like middle-aged men and women are pushing that. What's next for the demographic problem in Greece? The data included in the Elstat report demonstrate a clear demographic risk with significant social implications, which is part of the context of the economic and social pressure facing Greek households. The decline in births and the rise in divorces indicate the need to rethink policies concerning the family and the support of the younger generation towards sustainable social change. Demographic crisis, brain drain. The latest population census in 2021 showed a 3.1% reduction in the total population in just 10 years, with a total of less than 10.5 million people. This broadly corresponds to the economic crisis the country went through, which fueled the exodus of about 500,000 Greeks, especially among young and educated segments of the population. Those who remain in the country are still facing a difficult labor market recovery, characterized by high unemployment and low wages, making it even more difficult to create stable careers and families. Huh. Do people think that you should bring babies into a world or into a country with high unemployment and low wages? Probably not. All right. And I don't know if this is Chios or Chios, but I think maybe Chios. On Chios, an island of 50,000 people in the North Aegean, Euronews spoke to Mary and Nikos, a couple in their 30s who left Greece for the United States 2 years ago and only occasionally returned for vacations. They reflected on their decision to immigrate, citing financial difficulties as the main reason. If you have to work 10 to 12 hours a day and don't earn as much money as you want, how can you buy a house? And how can you have a family? You can't, Mary said. Nikos agreed with her, stating that while they love Greece, they can't see themselves returning even if conditions improve. Demographic crisis: Greek population is getting older. This is a stark reminder of where the country is headed, as low fertility rates, 1.32 births per woman, and higher life expectancy are rapidly leading to a shrinking and aging population. Greek economist Nikos Vetas highlights in speaking to Euronews the economic consequences of this demographic change, which is putting additional pressure on Greece's pension system and health services. The main problem, Vetas said, is that you will have a smaller number of people working, and now these people will have to support a large population of elderly people. However, Vetas adds that some measures can be taken to mitigate the problem. We need to increase productivity in the country. New technology should come in, encourage an influx of immigrants, especially in high productivity jobs. So basically, we are hearing the exact same story, just maybe a slightly different accent or a little bit different seasoning, but it's all pretty much the same. These countries, especially, and I don't know Greece. Are these people typically kind of xenophobic? They only do they typically denigrate immigrants? I don't know. Some of these countries, United States, I believe is one of them, is being propped up by immigrants, despite the fact that our country denigrates immigrants. And the whole thing about we need to have some kids because we need to support these old folks. Everybody keeps saying the same thing, but how are you going to support the people who have babies if unemployment is high and wages are low? Who can get a house, feed these people because babies need food, mamas need food, families need a house? How are you going to support that? All right, y'all, join the conversation. Let me know what you think. Join the conversation. If there's any other countries I should be looking at, make sure you send me articles to my Instagram inbox at Bourbon Bougie, just like my name on these social media streets. All right, like, comment, and share. Vladimir Putin's war with Ukraine has made the demographic crisis of Russia even that more exacerbated. So now what are they doing? They are stopping the census. So let's just not even talk about how the population is decreasing because of this war. So this article from Newsweek says Russia scraps population census as war casualties mount. According to this screenshot right here, it says the population peaked at 149 million in 1994, but has since dropped to 146 million. And I wonder where it really is right now, because you never really know if they have put out, real and honest numbers. But let's get into the article. It says Russian President Vladimir Putin has signed a federal law suspending part of the all Russian population census. According to some sources, this measure is intended to hide Russian society from the demographic impact that the casualties in Ukraine are having on the population. A tally by independent Russian media outlet Media Zona and the BBC News Russian release on September 27 said that more than 71,057 Russian soldiers have been confirmed to have died, an increase of 1998 since its last update in mid-September, although an estimate by Kyiv in the same month put Moscow's total losses at over 649,000. Newsweek has not been able to independently verify these figures. The law, effective until January 1st, 2029, halts paragraph 4 of Article 3 of the Census Law, affecting the frequency of selective federal statistical observation, which traditionally cover a sample of at least 5% of the population. The suspended paragraph had mandated regular surveys as part of Russia's ongoing efforts to track population changes. However, with this change, it is unclear how Moscow will proceed with population tracking in the coming years. The suspension was approved by the Federation Council on September 25th. Russian officials have yet to clarify if or how they plan to compensate for the lack of up to date population data over the next 5 years. Additionally, Moscow's suspension of this key census component may affect international bodies and businesses that depend on the country's demographic data for analysis, market strategies, and forecasting. It also adds Russia to a growing list of countries grappling with how to maintain accurate population statistics in the face of financial, technological, and political obstacles. While the suspension is set to end in 2029, it remains uncertain whether other changes to Russia's census process will be introduced during this period. So they're like, you know what? We just won't count. That way, all of these people that are expiring because of this war won't even really happen. And obviously, the crazy thing is that they really want babies to happen. And how would they even know? Are they going to track it? Who knows? These people and their leadership there is quite interesting. All right, y'all. Join the conversation. Let me know what you think about this. Don't forget to like, comment, and share.